Good evening, everyone, and thank you for coming back one more time. Tonight, we're going to continue sessions that will help to look at understanding the healthcare system. We're going to talk about midwives. What do you know about midwives? Has anyone ever used a midwife for their care? Well, let's share some information. Do you know how many midwives there are in the United States? Are you aware that midwives have been proven time and time again to be safe, to actually reduce the number of low birth weight infants? That record is out there. So let's talk a little bit more. There's actually more than 16,000 midwives in the United States. And the safety of midwives have been proven by the Institute of Medicine actually decades ago. There are numerous news articles, journal articles that talk about the safety and efficiency of midwives. But what I'd like to do is to give you some history of midwifery in the United States. And it's going to have a great history and also a dark history as we look at the issues of racism and how this has also affected midwives in the United States. Not only Black midwives, but other immigrant midwives who were brought here through immigrants coming to the US, but for Black midwives, mainly through the slave trade. I'm going to share slides again. It helps me to stay on point. It also gives you reference because sometimes there's a lot of information to present. And if the slides are there, you can go back and review them when you view this video. So give me a second. Midwives have been around since biblical times. It's the oldest profession, as people would say. And remember Moses and the midwife and his mother using the midwife. So that's something to know. We've been around. We have a valuable role to play. And in the United States, particularly in the Black community, midwives were a very important part of the slave trade and were highly, highly valued, not because they were such great people. They were valued because they helped to maintain the health of the slaves on plantations, as well as facilitate in the birth of slaves on the plantations. Not only the birth of the slaves, but also the birth of the slave owners' wives. And so they were seen as very, very valuable, as I would say, commodity, not because they were seen as persons. The other is that midwives were able to go outside of their own community because they would go to other plantations to assist with the birth. And because of that, they were able to be kind of a way to join those communities together. They were seen as very important. They provided food and clothing. And they were just a very, very valued part of the community. What I do want to say is that if you remember the slave trade, the actual official slave trade ended in the 1830s. However, slavery in the United States did not end at that time. And so the question is then what happened? How did these slaves come about? That was because there was the breeding of persons, Black persons, during that time. And the midwives were the ones who assisted in those births. So the midwives were seen as important because they were helping to increase the workforce, not because they were important as individuals. However, when they don't want you around, there's going to be a way to help get rid of you. And so in the 1920s, anesthesia was introduced into the United States from Europe. And for women who were white women and who had money, they wanted this anesthesia. They had moved into hospitals because they couldn't do that anesthesia at home. Doctors were more involved. These were more general practitioners, not the specialized doctors that we see today. And so, because you wanted more people to be able to take care of, get money from, experiment on, um, women were moved into hospitals. There was also a very deliberate campaign to get rid of the grand midwife. And so it was seen as though midwives were causing infection or blamed for infection that may have caused a death of a baby in communities. Whereas once birth got moved into hospitals, the truth is that there was a great increase in maternal deaths due to the poor sanitary conditions that were maintained. There were rules that were put into place. Laws became more restrictive. There was now the supervision of midwives, not because we cared so much about you, but because we're now going to point out why you can no longer practice. And so there was a deliberate campaign to eradicate midwives from communities, not only Black communities, but immigrant communities as well. So now let's move to today. There's all kinds of midwives, but I need to help you make some sense of this. You hear all these terms: lay midwife, direct entry midwife, certified nurse midwives, certified professional midwives, licensed midwives. Who are all these people? What is all this mumbo jumbo? Let's try and make sense of it. I have the slides here because it's a lot of information to share. And I'm thinking that with a slide, it will help to make this information clearer. And at least it's a point that you can come back to. So let's start with what are known as certified midwives and certified nurse midwives. These midwives are under the American College of Nurse Midwives. They are either nurses or they have a bachelor's degree from another field. The programs at this point in time are master's degree programs. So you need to have a bachelor's degree either in nursing or another field to be able to enter a midwifery program under the American College of Nurse Midwives. There are 48 of those types of schools in the United States. They offer either a master's program or doctoral degree. And once you finish your education, you will then be certified. You have to take a big board exam, just like lawyers have to take their bars. That's a board. You have to take a board examination to prove your knowledge. And then you also, once you pass that board, it is a requirement for you to be licensed in your state. I am a certified nurse midwife. I knew when I was a little girl, I wanted to be a nurse. And when I was in high school, I was very interested in biology. And so I knew early that I wanted to be a midwife as well. And at that time, I was very interested in the nurse midwife route. I worked as a year in general medicine. I then worked in labor and delivery. And then I went back to school to study midwifery. It was a very intense program, I promise you. And then once I finished that program, I had to sit my board examinations, pass those boards, and then go and apply for licensure in my state. So I had 2 licenses, one as a registered nurse and one as a nurse midwife. And that is the case for certified midwives. They also have to do the boards. Once they pass the boards, they then have to get licensed in the state that they want to work in. For certified professional midwives, if you look to the right of the slide, they are under the Midwives Education Accreditation Council. With these midwives, the requirement is that you finish high school, but it's also a rigorous program. Some of those programs are 3 years in length. This is the direct entry manner. There are 8 of these schools in the United States. And when you complete that education program, you either have a certificate. Some programs will offer an associate's degree. Some programs will offer a bachelor's degree. They too have to complete a board examination to prove their knowledge. And once they complete that board and pass that board examination, they then are able to apply as a licensed in their state. They are able to be licensed in about 33 states and in Washington, D.C. Certified nurse midwives can be licensed in all 50 states. Certified midwives are licensed in a less number of states. So what do? Where do they work? Well, certified nurse midwives and certified midwives can work in the whole gamut. We can do home births. We can do birth center births. We can also work in the hospital. I have worked mainly in hospitals, and that's been purposeful because I've wanted to try to protect women from unnecessary interventions that are not needed. Also, certified midwives and certified nurse midwives can also do women's health care, including gynecology, family planning, your physical examination. They're able to do that. If we go to the right side of the slide, you will look at certified professional midwives. What do they do and where do they work? Their scope is a bit smaller. They work out of the hospital, either in home births or in birth centers. Their scope of work is more for pregnancy, for labor and birth, post-delivery, and to follow you post-delivery. Insurance will cover the care of certified nurse midwives, certified professional midwives. You will need to look in your state and with your insurance program as to who they will cover and what they will cover. And this just gives a little bit more information on the different types of midwives, what are their educational requirements, who does their board examination, does Medicaid cover, where Medicaid covers. It depends upon the state. As with other services, it depends upon the state Medicaid program and where they can be licensed. I want to say a little bit about doulas. Doulas you're hearing more and more about. They are professional support people. They do not have the ability to do medical care or nursing care. They're not nurses, they're not midwives. But what they do is to provide more support from emotional support. They can help you during pregnancy. They can help women during labor and after birth at home as well. They work alongside a midwife in hospital or at a birth center or home birth. And they can provide education to you during pregnancy, labor, and birth, and also post-delivery. But they are not medical professionals. They are not nurses. They are not midwives. So there's lots of information here in terms of where you can find a midwife, where you can find doulas. That information will be in the description for this particular episode. So I hope that has provided you with more information about midwives. It's interesting because with the increase in maternal mortality, there's been a loud outcry about what about the midwives? We have information from the Commonwealth Fund, from U.S. News and World Report, NPR, really talking more about midwives, their track record of safety, So this is the question now being asked. Why are we not using more midwives? There's evidence there that show the safety. So I hope that this is information that you did not know about midwives. I hope that you will use this information to consider your options for labor and birth. The one thing that I want you to know is that even if you have a pregnancy that does have risks, midwives work with doctors. So it's possible to be cared jointly with a midwife and doctor during your pregnancy, even if you do develop risks where that midwife and doctor are working hand in glove, working very closely. So that's an option that you can investigate and think about and see if that's something for you. So once again, thank you so much for your time. We're going to end this session. Tomorrow, we're going to talk about all the different types of doctors, particularly when you go into a teaching hospital, so that you can understand who's taking care of you. Are they the best providers for your care? So thanks again. I hope that you've enjoyed the information that I have presented. I will be coming out with an ebook really soon that talks about the causes for maternal deaths. I hope that you will like and pass on this information to your girlfriends, your mothers, your aunties, your nieces, your nephews, your husbands, your uncles, all of them. If you've liked what I've presented, I hope you will subscribe to my channel. And I look forward to seeing you again tomorrow. Thank you. Good evening.